Hi everyone, I'm Dr. Mila at Dance Prehab. So we get a lot of questions, especially for dancers on Pointe, about things that they can do to improve mobility or strength or how to recover, especially during really busy seasons. And so to help kind of navigate those situations, we want to build a resource for you guys for that. So we're going to navigate some things to improve mobility, strength, as well as some recovery strategies, especially during really busy times such as nutcracker season or competition season. So some of the things that we talk a lot about with our dancers, especially during really busy seasons, is really understanding how much they're dancing and how they are ramping up or getting ready for the things that they want to do. So take into account, for example, nutcracker. If we have someone preparing for like dewdrop and they have their casting, if they're performing in November, December, and they have their casting in August and September, that gives us that perfect opportunity during those 2 to 3 months before to start prepping for anything they might need as far as improving mobility or strength for pointe work or for the things that they need to be able to do. And usually we want that ample time to prepare because as rehearsals increase, usually there's kind of a sharp increase in rehearsal time, and we don't always have a gradual ramp up into that we want for the body to progressively adapt to those stressors. So this allows us some time to at least build up your capacity or like what your body can do so that it's a lot easier to navigate those more physically demanding and challenging activities with shows, with dress rehearsals, all of that coming up. And in that time frame, we really want to think about at least like 6 to 8 weeks, because we know that's about as long as we need to see a noticeable change in strength. And for tendon adaptation, we want usually often at least 12 weeks of consistent training. So with that, in an ideal situation, when we really want to thrive in a season, we have time to discuss your goals, to really break down what you need to be able to do at least 2 to 3 months in advance. And that may kind of change in terms of the exercise you want to focus on as we get closer to the performance, because we might need to focus a little bit more as you're building your rehearsal schedule, as you're dancing a lot more, maybe having less time for rest. We really need to start to emphasize potentially more recovery. So a lot of the exercise we're going to go through today can be very important in both like that 2 to 3 month mark before the show, or you can also do them about a month before, but oftentimes we just want to have a little bit more intentional focus of the exercises we're doing to make sure that it's exactly what you need in that time frame. So let's explore first some things that can help improve mobility and strength for pointe. So here are some things that we're going to look at to improve ankle mobility. The first one we're going to look at is to help improve ankle dorsiflexion, or how much you can flex your foot. So not pointing, but actually flexing your foot and bringing your toes to your nose. And usually there are a couple things that we see with our dancers where those factors can limit that movement. And if we think about flexing your ankle, you need to be able to access a deep plie to releve, to be able to go up into a jump and also absorb shock when you're landing from a jump. So it's a very important thing that we start to see maybe some restriction as we start doing more pointe work with more rehearsals. Maybe your calves are tight, maybe your ankles are getting stiff. So here are some things we can do to target that. So if your limitation is more calf tightness, beyond just stretching, one thing that can be really helpful is actually doing some soft tissue mobilization work of the calf to help improve the extensibility or stretch of the calf muscle. So we have a yoga block and a tennis ball. And I'm just gonna start by rolling the ball along the calf and finding a tight point. As I'm here, I can also point and flex my foot as I go through to help actively mobilize there. And you can work your way through any tight points. You can also slightly angle along the outside or slightly angle along the inside as well, working all the way up along the calf. And that will be for any muscular tightness of the calf that's really restricting or limiting that flexion or that toes to nose movement here. Another thing that can limit that flexed position or ankle dorsiflexion for the ankle, besides the calf tightness, is also stiffness in the ankle itself. So we have a joint capsule that surrounds the ankle joint, and sometimes we can have a little bit more stiffness within the joint itself in that movement of dorsiflexion. And so beyond addressing muscle tightness, we can also do some mobilizations using a band to help us improve that ankle mobility for plie. And like we talked about, that'll be helpful for releve, pushing off for jumps, and then for landing and having a better shock absorption when we land from jumps. So if our restrictions are more because of the ankle, for flexing our ankle or for plie, then we can do a mobilization with movement with a band. So we can place the band here around the ankle, the level of those two ankle bones. You're gonna be in a lunge and you're gonna try to move away so that you have a little bit of resistance from the band. And from here, I'm going to just allow my knee to dive forward and come back. So I'm controlling this motion into my plie and allowing my leg to move forward, and the band will help to mobilize the ankle joint. We can go in parallel, and we can also go in our turned out position here as well. Same idea, let your knees track over your toes and going into a deep plie that you can control all the way. So next we're gonna look at ankle plantar flexion or rolling up onto your demi-point or your box. So one thing that can also be helpful to help with mobility, just to give you a little extra support as you're going all the way up onto your demi-point or onto point, is to tie a band and have the band come right around the heel. You're going to want to have something nearby just to support you. So whether that's a foam roller or a bar. As you lift your other foot up, you're gonna push up into a heel raise, coming up, and then control on the way down. So this will help to give you a little bit more support as you go up onto your high demi point to get into those end ranges and then rolling down. As you do this exercise, you wanna make sure that you're really focusing on control, not just popping up and locking out the ankle, but really controlling that end point as you would want to when you're rolling up over your box. Other things that we can do to help improve your mobility, especially when you're going up to demi-point or over the box, is to help improve that ankle mobility, or how you're able to move through that ankle plantar flexion or pointed position over the box. So one way we can do that is with a traction exercise that you can do on your own. You don't need any equipment. You're just gonna use your hands. You're gonna sit down with your legs crossed. You're gonna take your hand on the heel, your other hand over the top of the foot, and you're going to gently guide your hands in the line of the leg pushing down, right? So we're gonna press down with our arms, with our hands, while your knee actively just stays lifted upward. So we don't want to pull the whole leg down. We want to stabilize and just gently traction the foot downward this way. We can do it also just gently starting to point through our foot as well to help with that ankle mobility, and really allow yourself to control that movement. Don't pull too hard, but you do want to give yourself a little bit more of a push so you're really tractioning or stretching the joint enough. So as we're preparing for the season ahead, especially since we're doing a lot of point work potentially, say it's Nutcracker or you're getting ready for competition season, whether that's YGP or Prix de Lausanne. So there are some things that we need to think about for building up strength, especially if you have a really tough variation or dance piece that you're working on point. When we think about strength, especially for point work, a really important factor becomes our calf strength. Because if we think about our calf, is as these muscles shorten, it allows us to point our foot or go up to demi-point. It also helps us to jump off the floor when we're jumping, and also helps us to control and decelerate as we go down, right? So when we think about building up strength, we want to prepare as much in advance as we can, especially if we know we're going to be performing a lot. And that's where that 2 to 3 month mark is helpful if you have the time to make room for it and to plan ahead to make sure that we're building not just muscle strength, but allowing our tendons to also adapt to these stresses. And the idea is that with strengthening, with all of these exercises, that as you are building your routine to build strength and endurance for the season, you are gradually increasing healthy stress for the body so that your body can work at a higher capacity and have much more foundational strength and support to support you in the things that you want to do this season. So let's talk about heel raises first. All right, for calf strengthening, there are a lot of different ways we can approach this. But the first thing we want to touch base on is how many we want to aim for. As a dancer, we want to aim for a life goal of about 30 heel raises in a row. That gives us an idea of how much strength we have in the calf to support us for those things like point work and jumping. So when we do 30 in a row, we want the heel height to be the same each time, right? We don't want the heel to drop. And we want to make sure our muscles don't fatigue and can support us through that whole time. When we're working on our heel raises, you can do a very traditional heel raise where you just have one leg on the ground lifting up and then down. You want to make sure you're going up as high as you can along the demi-point and then really keeping the toes elongated along the floor. Oftentimes we see a lot of dancers scrunching their toes, so you want to be mindful about keeping the toes elongated and being able to lift up high and roll down with control. It's nice to have a foam roller or a bar there for support as you need so that you can just focus on the quality of the movement. And we can start with doing heel raises with the knee straight first. This helps to bias a little bit more of our gastrocnemius or our more superficial calf muscle. And we can also train our soleus or our deeper calf muscle if we slightly bend the knee and lift up this way as well. A great way to test how many you can or should be working on is actually just seeing how many you can do without getting tired. We want to also make sure the heel height is high. So if you have a physical therapist or a friend who can kind of keep an eye on it, and you can even shine a light or like a little laser on the outside of your ankle bone to make sure that you keep that level consistent. And if it starts to drop, they can let you know that your heel height is starting to drop and that that's kind of your limit for those heel raises. But otherwise, you can just see how many you can do before you get tired. And that's a good kind of assessment for yourself where you're at in that maybe like 30 range, or if we need to build a little bit more strength, we can expand on that. Or if you're at 30, great, you're at a really great pace and you want to just keep working on those heel raises to make sure you have that support you need for the season. Another thing we can work on in terms of really controlling how you're rolling up over the box. Oftentimes when working with dancers, we start to see or hear feedback that they have trouble really pressing up over the box. They feel like they're kind of like sitting back and they don't quite go all the way over. One thing that we can start working on to improve not just the strength, but really also the control of that movement is some heel raises, but with a band around the midfoot. The idea is that you're going to be pressing your foot into the band as you roll up. And we also really focus on controlling that end point when you're up on demi-point or up on point so that you're not just locking out your ankle, especially for a lot of very mobile dancers. It's very easy to lock the ankle joint, especially on point. And it may feel stable, but the challenges of that is that we're not really actively supporting and using our muscular support for that movement. So this is a great exercise for if you're working on building a little bit more strength, building a little more awareness to push up all the way over the box and being able to actively support it with our muscles, right? So you're gonna have a band around the midfoot. I'm gonna just have the other two ends right underneath my other foot so it can help anchor and stabilize it. And as I put my foot on the step or on the ground ahead, I'm going to gradually and slowly lift my heel up, controlling through demi-point. I'm reaching up as high as I can on my demi-point, keeping my toes elongated so I'm not scrunching them. And then I'm going to control on the way down. You can also do this on point as well, just getting a little bit of feedback from the band as you're rolling up over point to really be mindful about how you're utilizing your muscles to support you in that full demi-point or point position. So besides ankle strength, right? So besides working on our calf strength, other things we really need to focus on for the strength of dancers going onto point or going into very intensive seasons for point work is looking at the rest of the lower body and how we work as a unit to go up onto the point or onto your box. So when we think about single leg strength in terms of point, there are a couple things we really need to emphasize. We need to have strength through our quad, right? To be able to stretch our leg as we're extended and standing on our box. We need strength in our hips to extend, right? And pull up nice and tall. And also in the gluteus medius, we wanna make sure we have strength here so that we're not sitting or kind of sitting in our hip and not really staying supported up and over our hip and keeping our pelvis level. So a couple of things that we can do to just help improve a little bit more of the coordination as well as control and start to build strength are a couple of exercises, and both you'll notice are on single leg because oftentimes we're dancing mostly on one leg, right? And you need to be able to releve and pique on one leg. So we want to really make sure that our exercises also reflect the load or the kind of challenge that our dancing asks of us. So if we think about, for example, skater squats, we can start from here, one leg extended back. You're going to think about reaching your shin down towards the ground, letting your knee come forward and your trunk come forward, and then coming back up. This is a great exercise to look at knee, ankle, hip mobility. So for example, if you're going down and you feel tightness in your ankle or your calf, this might be a good chance to revisit some of the mobility exercise we were talking about earlier with the soft tissue work with the ball and the ankle mobilization with movement. If you feel like this is challenging to do because of muscle strength, then this is a great opportunity to build on that by doing this as an exercise. So with the skater squats, the especially helpful thing to think about when we're transferring this to point work is as you're going down, yes, we want to control and go down as low as we can with control. But when you come up, you want to think about letting that hip come forward, stabilizing here so that we're not throwing our shoulders back. A lot of dancers, to compensate for getting over their box, if they're not quite strong enough, is by getting over the box, because what you see in the mirror is your box either being flat on the floor or sitting back, right? And for dancers that you maybe don't quite have enough strength, they might try to compensate by either bending the knee a little bit to push over the box, or they might throw their shoulders back or kind of lean especially forward. So this is really looking at coordinating all of those movements from here by using our glutes to extend and stabilizing through our trunk to make sure we're really strengthening as a whole. If you feel like you're ready for a little bit of an extra challenge, you can grab a weight and reach it down away from you towards the ground and then come back up. So just something to think about there. So besides our glute max that helps us to extend our hip, right? And when we think about getting up over the box, we really want to make sure we're staying up nice and tall with our hip bones pulling forward. We also need to focus on our gluteus medius to make sure that we're stabilizing at the hip and pelvis. So if we don't have strength and support here, what you might see is that you're kind of sitting in the hip, or it might also feel like you're kind of sitting in the shoe. Not the only reason why someone might feel like they're sitting in their box, but something to play around with and maybe see if this helps you with that feeling. So what we're gonna think about is standing on one leg, having that feeling of lifting up and out of the hip. And we're going to use a med ball. It doesn't have to be heavy. It can be a light object and really can even just be something like a yoga block. It's something to kind of guide you to coordinate the movement better. So it's just to cue you. So from this position, and I'm actually gonna face this way so I can use my fingertip touch on the wall for a little bit of extra support. I'm gonna stand with the med ball over my right side, standing on my right leg. And with a little bit of a finger touch support, I'm thinking about really lifting up out of the hip, punching the med ball to the ceiling. And from here, I can go into my heel raises, focusing on length through the toes, rolling up as high as I can, staying lifted, punching the ball up as I roll down with control. And an extra challenge would be, of course, trying this on point. And boy, do we love elevates, right? No plie. All right, let's now start to shift focus to more of a recovery focus. If we have time at the beginning of a season, right, we have 2 to 3 months, we can really start preparing to really thrive by building on our mobility and our strength for point work. And you can utilize these even close up to performances, right? We can utilize those exercises to our benefit. But there is an added focus when we think about preparing and thriving during shows and actual show runs to make sure that we prepare our body and take care of it, not just after, but prepare it for the next day, especially if you have shows back to back, like a Nutcracker weekend or a competition weekend. So with that, we can start to also look back on some of the things that we worked on before. We did some soft tissue mobilization work along the calf. That can be really helpful, especially if you're feeling some tightness in the calf, if you're feeling some limitations with your plie, like you can't go into as deep of a plie. We did that ankle mobilization with movement with the band, where we were letting the knee come forward, both in parallel and turned out. And those will help us with mobility for the ankle as a recovery strategy. But here are some other things we may need to focus on, especially when we use our feet and ankles so much during really highly busy point seasons. All right, so other ways we can take care of our feet, especially if you have like 4 or 5 shows in a weekend, is to help address some of the tightness in our feet using a tennis ball. And oftentimes we have dancers that just kind of roll their foot, but we're trying to kind of create a little bit more intention with this exercise by really being mindful about where you're placing the foot and where you're placing the ball and what you're doing. So we're going to utilize the tennis ball underneath the foot. You can start underneath a little bit more along the inside. And we're going to start with some pulses, just gently pushing the foot down into the ball. So I'll show in a second, but you'll be standing on it like this. And we can start with about 8 to 10 pulses here and start to move it over under the other metatarsals or bones of the foot. And we can also start to move it along the inside of the arch here and along the outside and just along the inside of the heel here. So let's talk through this exercise and let me show you how it's gonna look. From here, standing up, I'm going to just place the ball underneath my foot. So instead of just rolling it back and forth, I'm going to just gently press weight on it. And I wanna feel like my foot just melts over the ball. And we're gonna do some gentle pulses pushing down. And then I'm going to gently move the ball over a little bit towards the middle of the foot and then repeat. And just as we talked about earlier, you can move all the way along the metatarsals towards the outside of the foot. We can also bring it in along the inside of the arch here and press down. We can also go along the outside as well. And then we can go just to in front of the heel here, pushing down, just gently pulsing each time, just to help supplement some of the things you're probably already doing to roll out your foot, especially if it's feeling very tight and restricted from all the point work. All right, so far when we've talked about improving mobility, we've really focused a lot on the ankle itself, right? Especially the calf restricting that dorsiflexion or that plie motion. and also improving mobility for pointing and pressing up over the box. And really, a lot of that movement comes from our tibia and this bone here, that talus, rolling and gliding to make that movement. But there are other parts of the foot we have to consider too. And with our 3 parts of the foot, we have a rear foot, a midfoot, and then a forefoot. And with that, one thing that we often see with dancers is when you are pointing and using your feet so much and you're wearing your pointe shoes all day long, sometimes we get some restrictions or tightness, especially in the midfoot. Or we sometimes see overemphasizing in class, like that lifting of the arch as well. And sometimes we don't also allow that midfoot to really be flexible, but we need that flexibility, whether we're walking, whether we're just standing on our foot. We need our arch to also be flexible and pliable, not just from a movement perspective, but it helps to absorb shock as well. So it's really important for our foot to be able to move through those positions. So one way to improve midfoot mobility is just seated here. You're gonna cross your foot up and over. I'm gonna take, this is my left leg. I'm gonna take my right hand over my foot. And then I have my left hand over my inside of the ankle. And I'm going to think about moving in opposite directions. It's almost kind of like you're wringing out a towel in a way, but you're going to take hold of your foot and ankle and gently rock back and forth. So one way just to get that midfoot moving a little bit more so that it's a little bit easier to add a little bit more flexibility to the foot. That's going to be important not just for mobility, but also shock absorption when you're standing and walking. In addition to those mobilizations we've covered so far, another thing that we can work on is mobilizing those metatarsals of the foot. So one thing that we can start with is essentially I'm going to grab my bones here and I'm just going to gently rock back and forth, just trying to encourage a little bit more mobility along the foot. I'm going to sit with my heel supported. It's going to be a little bit easier to balance this way. And then one finger on my right hand on that right side, or like the most inner portion of the foot. I'm following the line of the big toe and grabbing hold on that bone. Then following the line of the little toe down, I'm gonna grab onto those bones and just gently rock them back and forth. Just trying to encourage a little bit of mobility along the foot, and I can work my way across that way as well. And then you can switch to the other side. You'll take your left hand along the inside of the foot, right hand along the outside, follow your toes along those bones, and then just gently rock back and forth, mobilizing as you go across the foot. All right, so lastly, we're gonna work on the mobility of our big toe. When we think about dancing on pointe, especially for long performance runs like Nutcracker or for competition seasons, we're on pointe for hours at a time. And so sometimes rehearsal days can be 6 to 8 hours long just in pointe shoes. That's so much time that you're spending always pointing, and that can start to show in terms of tightness in our demi-pointe, right? So oftentimes we'll hear that the dancer has tightness in demi-pointe. They feel like they can't push all the way over. They feel like there's tightness or stiffness in the big toe. So here's a strategy that we can work on for the joint mobility. So not muscle, but the joint itself of the big toe. So we're gonna grab your foot. We're gonna cross it over your other leg. It's nice to do this seated so that you can just let your leg relax and then allow your hands to wrap around the big toe. From here, you're going to grab the big toe with your hand and you're going to grab hold. My other hand is going to stabilize or hold the foot in place. And I can gently pull the big toe away, following the line of the toe there. So I wanna make sure I'm not angling down or pulling up. I'm going straight out and holding here. Since we're working a little bit more on joint mobility, we wanna hold for a little bit of a longer hold than just like a muscle stretch. So you're thinking about holding anywhere from like 20 to 30 seconds at a time and repeat it 2 to 3 times. Just going for a little bit longer holds and thinking about how we do this in the context of all the other exercises we've covered so far. We want to think about the order that we've approached everything. You will have noticed that we did things like the soft tissue mobilization with the ball first, and then we started going into mobilizations of the joints. There's a reason to that. It helps us to address that soft tissue tightness or restriction first, and it helps us to approach these joint mobilizations like we did with the metatarsals, with the big toe, with the ankle, with the band. It helps us approach them and make them more efficient because we are addressing that muscle tightness first. So just something to think about as well when you're going through these exercises. The order we're presenting these is a great way to start and a great way to approach these exercises as a whole. So as we went through all the exercises, hopefully you have some ideas for maybe how you might want to approach your season, whether that's 2 to 3 months out and focusing a little bit more on mobility and building strength. Or if you're in the middle of your performance season or gearing up for it, then you have some recovery strategies as well. So to look back on the things that we talked about, a couple things that we also have to touch on is really also the importance of preparing your point shoes. If we're talking about really thriving during your performance season, it is so important to have your point shoes properly fit by a professional, and to also make sure that you have enough point shoes going into a performance. And that is always tricky, especially since the pandemic. There are challenges with availability, with makers or models no longer being made or available to dancers. And so we've seen a lot of dancers go through a lot of shifts. And so it can make it hard to be really prepared if you don't have your kind of system as you had before for that. But working with a wonderful point shoe specialist who can take you through the fitting process and help make sure you have the right tools at your disposal is really important, and not dancing in dead shoes, because that can increase your risk of injury. And also some things to think about are even like ribbons and elastics, making sure you're sewing new pairs every time, because as they lose their elasticity, that can also limit the support your ankle and foot has on point. So with all that being said, when we think about surviving the season with recovery, there is a difference between surviving in the sense of recovery and surviving with injury. And as we always want to emphasize, if you're navigating an injury, if you are noticing pain that is new or just something different, it is always important to reach out to your teachers, to your physical therapist, your doctor, your team that can help you to navigate that. You're definitely not alone, and hopefully if this will give you some kind of resources to start to glean from, we're always happy to help as well if you have any further questions. But if you have something more elaborate or more extensive like an injury, make sure that you talk to a health professional so that you can get individualized guidance on getting back to stage. And otherwise, we hope you use this resource to continue to just thrive in your seasons ahead. Thank you.